Hi, my name is Dr. Michael Corey, and I want to thank you so much for subscribing and getting these special videos regarding your thyroid and how to heal from thyroid dysfunction naturally. No drugs, no medications in most cases. We can usually get your thyroid functioning properly. But what's important is the evaluation and what you do about it. So have you ever kind of pondered and thought about, well, my doctor says my lab tests are normal, but I'm still feeling the fatigue, the hair loss, the weight gain, the insomnia, the digestive issues that come along with thyroid dysfunction? Well, there's a good reason why. And that reason why is one thing I'm going to talk to you about today. Now, when we look at lab values, I want you to understand that lab values are very inaccurate according to when we look at traditional lab values. They're based off of a bell-shaped curve that we saw way back when we were in school. I don't know if you remember those bell-shaped curves or not, but they're very inaccurate the way that they're evaluating you, because these functional lab values are much more sensitive and they reveal problems much more evidently. I'm going to talk to you about this. So if we look at that bell-shaped curve, it comes back, comes all the way to the top, and it comes right back down the bottom. If we look at the cone or the cap of that bell-shaped curve, you're going to see that that falls right in line with right down the middle. That's where the optimal, healthiest patients are in that population that they tested to come up with these lab values. So your doctor is going to evaluate you from an abnormally low value to an abnormally high value, okay? Super high and low of the whole population of people that were tested for that specific marker. In this case, TSH, or thyroid stimulating hormone. We go to that top end and top bottom and we shrink that back in, we're right at that functional lab range. So if you're falling outside of that functional range here, your doctor says that you're normal, when in actuality, you actually have hypothyroidism. When we come back over here, we're going to see that the same thing is true. We're out of the range and we have dysfunction within the thyroid. Now, what I'd like you to understand is when we look at regular lab values, we're going to look at TSH, or thyroid stimulating hormone. And that's 1.8 to 3.0. That's that small marker we saw in the middle. Now your doctor is going to let you go from 0.3 to 5.7, that big wide range we looked at. And if you come up on your lab test and you have a 4.2, you actually have hypothyroidism. And you can also be susceptible to all those symptoms we just talked about. So what I'd like you to understand is that we use metabolic treatments in our care. This is one of the major reasons why we're getting chronic patients better. We're simply running the necessary tests that are required to make sure that we correct the underlying causes of the problem. We're going to look at the liver, we're going to look at the adrenal glands, we're going to look at the stomach and gut function. We're going to check it for leaky gut if that's the case with you. But this is vastly different from what your PPO and HMO providers, or the model of healthcare, is, because I want you to ask yourself, how long have I been going to my PPO or my HMO doctor and I'm still experiencing the same dysfunction? Well, you're going to continue having that same evaluation, because what they're using in the traditional marketplace is a 60-year-old model. 60 years they've been supplementing you with synthetic hormones. Well, there is a better way. And what I want you to talk about is, I want to talk to you about personally how I can help you to overcome this and put this in your past and take control of your life. If you're sick and tired of being sick and tired with these thyroid problems, I want you to give me an office call. And within that office call, I'm more than happy to have a consultation with you over the phone if that's what you'd like. Or else we can just directly schedule you for an examination. And I will review your past blood work. We'll go through and do an examination with you. I'll talk to you about your options and how we can get you better. My name is Dr. Michael Corey. Our telephone number at the office is 714-730-5833. Thank you so much. Have a great day. Hopefully this treatment tip has been helpful for you. Thank you.